Let's continue with the aesthetic approach to Invisalign. It's important to divide the face into thirds and to see if the thirds are equal. Now, you start with the end of the hairline to the upper of the eyebrow. From the upper of the eyebrow, you would go to somewhere where the nose ends. This picture is a little higher, but you would want to be where the nose ends and then to the chin. Chin would be the next stop. The key important thing here is not to look at these lines, but to realize that if we were to measure the top, the middle, and the bottom, if the bottom would be too long compared to all the other layers, then what we would need to do is maybe bring the teeth in the back in, and that would bring the chin forward up a little bit, and that would create harmony. Now, this is a very advanced concept. It's not for this training. This is just more for you to understand that the thirds play a very important role in designing an Invisalign case, and you should always consider both the bone health, the gum health, and the teeth positions, whether they could be brought in or not. Now, continuing with our journey, we've covered the vertical line, we've covered the horizontal planes, we looked at the teeth. Now let's look at the position of the teeth within the mouth and how they relate to the jaw. Now, the right and left sides have what's called an AP relationship, or what we refer as the front area as the A and the back area as the P. And the letter A stands for anterior, and the letter P stands for posterior. Anterior, posterior is a fancy name for front and back. The anterior to the back, we're looking mainly at the teeth relationship to each other. Now, class 1 is where the upper teeth are over the lower teeth. And class 2 is where the upper teeth are shifted way forward than the lower teeth. And class 3 is where the lower jaw is shifted way forward versus the uppers. Class 1 is the ideal. Class 2 and class 3 are the wrong positions or malpositions, which if possible could be corrected, if not, should not be touched when we're doing Invisalign. Now, when we're looking at this anterior-posterior relationship, we're looking at the canines and the molars. Now, what does that mean? Well, let's look at a deeper view. The canine, we already know which teeth that is, and the molars are the first back teeth. In a class 1, whether you're looking at one side or the other, the key point is to see that the bottom, even though the upper teeth are over the bottom teeth, because the front 4 teeth of the lowers are very small compared to the front 2 teeth and the side 2 teeth at the top, it kind of brings all the teeth forward on the bottom. Now, when that happens, this sharp edge of the upper tooth seems to be behind the lower canine. So in a class 1, the upper canine, the tip of it is half a cusp, half a curve behind the lower. And the same thing happens because the front lower teeth are very small compared to the top ones. The molar is also, if you look, half a cusp. These curves right here, they're called cusps. Here's cusp 1, here's cusp 2. On the bottom, here's cusp 1, here's cusp 2. It's half of a cusp forward. Now, even though the upper jaw goes over the lower teeth, it's that the lower teeth are pushed slightly forward because the front lower teeth are small. Now, whether we look on this side or this side, we know that the tip or half a cusp of the molar and half a cusp of the canines, they're in front. On a class 2, since the jaw, if you look at a class 2, the upper teeth move way forward, it's not that the bottoms are in the front. Here we see that the top teeth are shifted forward. And you can take a picture of this and study it as you go and watch some YouTube videos for better clarifications if this all doesn't make sense for you, but with time you'll understand. The key point is just to look at the 2 reference points. I always say look at the top 2 teeth, and you can see since the jaw is shifted forward for a class 2, the top tooth is in front, the top tooth is in front instead of the bottom teeth being in front. On a class 3, since the lower jaw is shifted forward, you're going to have the bottom teeth, the molar and the canine, way forward in the wrong position as compared to the lower teeth. That's because the jaw is shifted forward and you're bringing everything forward. Now, if you look at the blue picture here, the blue teeth, we could see that the molars, we see that the molar on the bottom one is a little bit forward than the top. That's class 1. The reverse happens where the top molar is shifted forward on a class 2, and a class 3 is when the lower molar is shifted in front of the upper. And that's called the anterior-posterior, or the AP relationship of the canine and molars. We always want to create an ideal position, but that ideal position isn't just going to class 1, it's what the patient's jaw and bite allows to do, and where we're having both function and aesthetics in perfect harmony. The teeth have to function well. Now we're moving forward for example cases.